Good morning, everybody. I know for some of us it's early on a Sunday morning. For some of us it's a little bit later in the afternoon. So thank you everybody for joining. It is my name is Mira Hellman. I am a gynecologic oncologist with JOMA, one of the founding board members from 100 years ago. Happy to be here today with this very important topic that we're going to be discussing and presenting to you, given the current situation and what's going on in Israel. So we have a phenomenal group of speakers here, or speaker and panelists, who have been very involved in frontline efforts during the war in Israel, and they're here to discuss their experience with us, what they've been going through, and what's going on the grounds in Israel. And we're very privileged to have them here. So I'm going to introduce our speakers. Our first speaker is Dr. Hagit Padova. She is a Deputy Director General for Quality and Patient Safety at the Tel Aviv Sourasky Medical Center. She's a physician who specializes in internal medicine, rheumatology, and medical management. Hagit is a lieutenant colonel in the IDF and served in the Medical Corps headquarters as head of Aeromedical Unit in the Air Force. She is married to Zoha and has 4 children and lives in Petah Tikva, Israel. Even intimidating for me to introduce that bio. Our next speaker, who is going to be a panelist and going to be helping fielding questions, is Dr. Tali Kapoa. She's a pediatric emergency medicine physician and medical director of MATAS, which is a simulation center at Ichilov Hospital. She was born and raised in Toronto, and after completing medical school at the Sackler School of Medicine, she pursued residency in New York. She completed her fellowship in Tel Aviv and worked in Ichilov since then. In the weeks following October 7th, Dr. Kapoa has led a team of volunteers and doctors to help train over 1,200 military healthcare workers and hundreds of non-military healthcare workers to prepare for the situation. When she's not in the hospital, she's apparently an expert schnitzel maker, and she is busy preparing schnitzels for her husband and her 3 children. And last but certainly not least, our very own Dr. Shelby Kasai. She is a trauma and acute care surgeon in Denver. She went to medical school in Technion and trained at the University of Colorado, where she did both her residency and her fellowship. She is married to Danielle, and they have 3 children together. For those who know her, we know this is very true. She loves her work hard, play hard, trauma surgeon lifestyle. And when she's not working, she's either running, watching movies with her kids, or shopping. As a separate note, Chevy has been very involved with the training that is happening at Ichilov. She went over there to volunteer and in one day trained, I don't even remember the exact number, and Dr. Kasai can update you on that, multiple volunteers in terms of acute trauma care on the fields. She is extremely talented and has generously volunteered a tremendous amount of time. She's also scheduled to go back again to volunteer in a more clinical capacity. So without further ado, I'm going to open the floor to Dr. Padova to start with her talk and show us her presentation. Dr. Padova.
Thank you. Can you hear me well?
Yes.
Okay, so good morning and Shavua Tov, and thank you very much for inviting me to speak to you at your Sunday club. I had the honor of meeting Chevy a few weeks ago when she came over to the Tel Aviv Medical Center to volunteer in our medical simulation center. And I've heard about your great organization, and it's really an honor for me to take part in your meetings. So I will just share my PowerPoint and we'll start. Okay, can you see it?
Yes.
Can you see the screen? Okay, great. Okay, so my name is Dr. Hagit Padova, and I'm Deputy Director General in the Tel Aviv Medical Center. The Tel Aviv Medical Center is actually the largest hospital in Israel. We have more than 1,500 beds with 1.5 million outpatient visits. It's a tertiary center, and we have a general hospital, a children's hospital, a women's hospital, and a large rehabilitation hospital. And over the last 2 years, we also have the largest emergency room in the Middle East, actually. We are a leading research and innovation center. And this is where I've been spending my last 5 years as a deputy director. Over the years, I started my medical career in the age of 18 in the Sackler Medical School, and after 7 years, I recruited to the Army, where I spent the next 20 years of my career. Half the time in leading roles in the Army. I was in the most of the years in the Air Force. I was a flight surgeon and the head of the aeromedical unit, and the last role was in the headquarters of the medical corps. The other half of these years, I had a fellowship in internal medicine and in rheumatology. The connection to that, to might talk to you today about what we experience now is actually the biggest experience I had or in my military years, and the only experience I have with a big crisis, that was in 2015, when I took part in the humanitarian mission to Nepal during the big earthquake they had then, with thousands of casualties. The medical corps had a mission that actually was a field hospital that was built on the ground of Kathmandu, and opened its gates to the locals 24 hours after the earthquake. That was the fastest that was done ever. We had there actually a tertiary hospital on the ground in tents, and we were the only healthcare service there at that time, because all the hospitals were ruined down. And that was a great experience. We've been there for 3 weeks, and only after 3 weeks, other countries have managed to get themselves out, also to help out in this crisis. What I've learned in this experience are two important things. One is how important it is to have a working and a firm healthcare system, especially during crisis time. And the second thing is the advantage of being agile. This capability of Israel to have a hospital built in 24 hours is unreplaceable by any country in the world, and it's a big advantage. And this connects me to October 7th. During October 7th, the first thing we did after we had the alarms at the morning, and after realizing that something big is happening, we came to the hospital and we started to see what our challenges are. And there were 5 of them. The first one was of course having the bombings in Tel Aviv and the alarms going on, and how to keep our patients and teams safe. The second one is preparing for a possible mass casualty event. A cyber attack is always a possibility these days. We started getting trauma-injured soldiers from the front lines, and we had to prepare to give them the best care we can. And at the same time, many of our physicians were recruited to the frontline units. Actually, we had 15% of our doctors recruited. The first challenge was the unknown. We didn't know what we were going to, and you'll see later that this unknown was a big challenge. So our mission, as I said, was to first keep ourselves safe, to have readily available healthcare services, to keep on our services working, to be able to give the healthcare that our patients need, to have a full professional and infrastructure readiness, to give mental response to victims and patients and teams, and also to support the national and military mission, which we are an important part of. So the first thing we did was to take out the plans we have for our emergency underground hospital. We have a 3-floor underground hospital that is capable of having 700 patients in it, and we started planning the way that the wards will go down to this emergency hospital, and the decision of when to take those departments to the underground was a big decision. Are we bombed enough? Are we in danger enough to endanger the quality of the treatment that our patients get by give it to them in a big garage that is very well equipped, but of course it's a compromise of the treatment that we are used to give. So this is a big decision. We ended up getting the top floors that departments down to the emergency room, and they're still there up to now. We have to keep our routines. We still have to give people the medical treatment that we did, and I'm proud to say that since October 7th, nothing has been taken off from the treatment we used to give. The hospital is working in full capacity. The operating rooms are working fully. Outpatient clinics, chemotherapy, and everything we do, and we continue doing also research and innovation, even more than usual. We're a level 1 trauma center, and our greatest mission is to give treatment to the injured soldiers that come from the front lines. For that, we are in continued contact with all the stakeholders that are into this thing, the management and the military. We see all kind of war injuries, and it's very interesting because we actually never in the past, I think since Yom Kippur, we didn't see any war injuries in the hospital. We have the bus bombing in Tel Aviv, of course, but not war injuries. So it's also quite new to us to see big blast injuries, inhalations injuries, all kind of burns. We also see civilians injuries. Thank God we don't see them a lot because of the Kippat Barzel, but we do see a lot of what we call alarm injuries. Running into the safe rooms and falling and breaking a hip is quite common. Not to speak of panic attacks that we see as a load. The next thing we did was expand or double our rehabilitation hospital. Of course, our main challenge is to get those injured soldiers back to their normal life and full functioning. It's actually a big national challenge because we don't have enough rehabilitation beds in the country. So we do have to double these beds and get as fast as we can those professional teams to give the best treatment they can in our rehabilitation center. And as you see, we get new technologies every day to make this treatment the best we can give, and it is the best. The question mark was the return of the hostages, which was, and I will hope will continue to be the biggest challenge, because no one taught me how to treat hostages, children, mothers, fathers that were in hostage for 50 and more days. It's not written in any medical books. We didn't know what to expect. And how to deal with it. And it actually was, there is the Pidyon Shvuim mitzvah, and it was as big as that. The thrill and the sorrow that came with it is you can't tell enough about it. Those people that came down in the choppers came straight to the hospital. We saw mental abuse of these people. We saw physical abuse. They were drugged. They were malnourished. And they were talking, every one of them had a different and a special story that I'm sure that will continue to tell and will continue to hear for many more days and years. And it, as I said, it was, and I really pray that it will continue to be the greatest experience we had during this war up to now. Those families that were united in the hospital are partly apart families, because many of them have their father still in hostage, not knowing dead or alive. Those people don't have homes to go to. They don't have any clothes, so it's very, very challenging situation. I want to say that being a tertiary hospital and giving the best treatment we can give to these injured soldiers and civilians, keeping our patients safe and working is really feeling very good, and we are a great health service. But still, I want to emphasize that we all walk around for, it's been 71 days, with very strong feelings of sorrow. We all know people that are killed or injured during this terrible war. I just want to show you just one example. This is Dr. Yael Adoni Tamir. She's a geriatric physician. She's in the management of the hospital. She has 13 family members that live in Be'eri, in Kibbutz Be'eri. As you can see, there are 4 of them that are found dead. Some of them that were hostages and were released, and some are still in hostage. All of them don't have homes to go back to. And this is how we deal with this. It's really a very, very emotional challenge we go through every day. Talking about that, one of the first thing we did after October 7th, that we built the mental support teams. Many of the citizens that live in the Gaza envelope settlements and the north are staying now in hotels in Tel Aviv and in the center of Israel. They need a lot of mental support, and we built what we call Ichilov Otef, enveloping Ichilov, and they give support to those people. We also have to give mental support to our teams that all are exposed to these heartbreaking stories. We are building these days a PTSD prevention and treatment center. Of course, we know that the PTSD incidence is increasing and will be greatly increased in the next few months and years. We are planning to build a mental resilience centers in the community, and we are planning to train. We have a plan to train local health givers to give a primary aid, mental aid to these people. Of course, we'll have a center, which a professional PTSD clinic in the hospital, but it will not be able to give everyone treatment right away. So we have to do it at a staged procedure. These are only part of our medical crew that are recruited to the army. As I said, 15% of our physicians are in front lines duty. They come to visit us with the choppers, when they bring in the injured sometimes, but other than that, they don't come home since October 7th. And we are worried very much and feel that we have to support them. I want to talk just a few words about my mission. As I said, I'm a military physician, and actually on October 9th, I was called on to be a part of the IDF Forensic and Identification Unit. It's called Unit 6017. It's a military medical unit, and it's part of the military rabbinate. This unit is composed mainly of dentists, pathologists, and forensic experts. I'm not neither one of those, but knowing that on the first few days after October 7th, the main front line was in Shura base, where the rabbinate military base is placed. We had a big challenge of hundreds of bodies that were unidentified, and we had to do a quick but of course an accurate identification process, and to bring them as fast as we can to burial. I was there for 2 weeks since October 8th, helping to manage this very, very sad and unthink of situation of having to identify so many mutilated and burned bodies. I don't think we even started to understand what this experience had done to me, to the Israelis, and to the Jewish nation as a whole. So we started by saying that we have a medical technology and simulation center, and Tali Kapwa, Dr. Tali Kapwa will join us later on, and we will share some things we did. But this was really a big mission that Tali has started off a few days after October 7th. Also, when our the physicians that were recruited to the army, came to us and asked for fast trauma training so they can take good care of our soldiers, and we'll build up a special training. And since that time, we have trained in our simulation center more than 1,000 healthcare members. We also train our hospital teams and hospital teams in other hospitals in Israel. We also started to train healthcare givers that join neighborhood watch teams. We built complex treatment situations that resemble real life, and they come in and they train about it. They do teamwork, and especially they go out with the feeling that they can give first aid and save lives. And we also have responses from them that they did save life after having trained in our simulation center. I want to thank you for having me again, and I hope it was interesting. This is my contact. I want to say that since October 7th, we had a lot of people from the States and from other countries, a lot of physicians calling us, asking to help in different kind of ways, by volunteering, by donating. We are happy to have all the help you can give us. And anybody that wants to ask questions or be in contact with me, I'm available on this contact up here. I want to end my talk with a little movie, but I will have to go out of this sharing screen and share another screen. That's it.
In the wake of the October 7th massacre, the Medical Simulation Center and Academy of Emergency Medicine at Ichilov Hospital have risen to meet the challenges head-on. Our multidisciplinary simulations emphasize preparedness and teamwork. Medical teams, unwavering in their dedication, train tirelessly side by side with a single purpose: to save lives. We provide vital training for our military personnel using cutting-edge technology and skilled simulation staff to equip them for saving lives during mass casualty events. We've also extended our facilities and expertise to civilians who form neighborhood watch and first responder groups. These skills are lifelines in times of crisis. Today, we need your support more than ever. Help us fund our new courses for civilian first response and sustain our essential medical and military training. Your contribution can truly make a difference, ensuring a resilient and prepared community ready to face any challenge or threat that comes our way.
Thank you.
Thank you so much, Dr. Padova, for that presentation. Even those of us who have been somewhat on the ground and those of us following what's going on, it's incredible what has happened since October 7th on many levels. Obviously, this is something that as a nation and as a country, we have never experienced on this magnitude before. And it's incredible the speed at which people were able to come together to address all these needs that came up. And even, based on what you said, things that no one knows how to treat, but somehow forming an organized system to try to do whatever is possible to help the situation is incredible. And as you stated, we've seen it obviously both from within the country and from the diaspora as well, a tremendous amount of immediate action that people have taken to try to help in this situation. So thank you so much for that. I wanted to open the floor to Dr. Kapua to see if there's anything else that she would like to add on top of the video where she spoke. Tali?
Hi. First of all, thank you so much. Feel so honored that we had Dr. Padova here to kind of show us her insights. I feel like we've just been working nonstop since the 7th of October, and I haven't really stopped to hear her whole holistic take on what's been going on. And for me, it was it was, amazing to hear. Feel very fortunate. It's a difficult word to use in these days, but I feel fortunate that we are in place where we can help and we can make a difference. It's part of what attracted me to being a physician. But I think now more than ever, we try and find purpose in what we're doing. And I think it's an amazing opportunity to give back to within the community, like we've been speaking, and having Dr. Kasai come in, and as well as you, Dr. Hellman, to come and see what we've been doing and try and help out in whatever way possible is really, really heartwarming and has done a lot for the cause. So,
Dr. Kapua, can you just, we were talking just for a few minutes before the webinar. Can you expand just a little bit from the emergency medicine perspective in terms of the inner workings, like in the hospital, how things have changed and maybe different things that you've needed to address as an emergency medicine physician given the situation?
So I think, first of all, a lot of, they talk in the media a lot about concepcia, the concept. So a lot of our conceptual understanding of the world really had changed overnight. And I would say it's very similar in medicine, but we hung on to our core values. So teamwork is imperative in a situation like where we are now. And one of the things that we really, really tried to work on is targeting teamwork. We talked about agility. I think it's very on point because I think one of the things that makes us the Israeli medical system unique is our unique ability to be agile and to kind of roll with the punches. And that's something that we've had to sort of use and move forward. I just came out of a meeting where I tried to organize somebody to come and see the trauma room, and I arrived. There were soldiers who had just arrived from the front. I went to another trauma room. We had a regular, civilian CPR case, and so it's really pushing our boundaries of what we need to do as emergency physicians. I think that's a lot. That's what I have to say. I can tell you that from the emergency gynecologic perspective, there has been huge changes because there are a number of hospitals who have been because of the crowding situation and the changes in the population, where everybody's living. So our hospital has been all the central Tel Aviv, greater Tel Aviv area hospitals are overflowing. We're very happy with very happy cases with women giving birth, but it's changed significantly as well. So everything is changing on a, almost immediate basis, and we're having to think about how to have creative solutions.
Yeah, it seems like a lot of this mission, I mean, not this mission, but a lot of this situation has been quick thinking, adapting as you go. As someone put it, who was on the state side trying to help get massive amount of medical supplies and quantities over there. It's, building the ship as you're trying to sail it, or building the plane as you're trying to fly it, which obviously is the hardest situation to be in. I wanted just to get back to 1 second to the issue with the shuvuim that were returned, and the infrastructure that is currently present and that's being built around it to help with that. Something that came up in the States, and I don't know if it's applicable or not, was a lot of mental health professionals looking to volunteer to help via telehealth, either because they physically can't come, or, it's obviously much easier to readily be available to help in that kind of situation. I was wondering if that's something that has been looked at all, if that's possible to coordinate at all.
Actually, we have telehealth here in Israel, so I don't see why not. I think it could be a great idea. We are very much. The number of mental health caregivers will surely not be enough to give treatment as much as we will need. So I think it's a great idea. We can try to get it up. Yeah.
Something to
And
consider.
I just want to emphasize, the staff who are taking care of the shvuim and the soldiers and the children who are affected and the mifunim, they are all suffering as well. And I think one of our goals has also been to build resilience within the healthcare workers. Our healthcare workers need these training days to sort of feel. I mean, I'm sure Dr. Kasai can also say what she felt when she was there, when they came to train. You have physicians who haven't done intubation in many years, and they're practicing, or haven't done, have never put a tourniquet on, and these people, I think telehealth will be huge for the healthcare workers as well. So we're going to need our our community of women physicians who are with us all over the world to help us when kind of the resilience within us. I find, for me, it was very, very uplifting to have an organization like yours come and say, hey, we're here, we're far, but we're here, and we're here to help with whatever you need. I think that's huge, and I can't overemphasize that point.
That's amazing. I did want to use that as a segue to ask Dr. Kasai to comment about her experience and her perspective from when she was there, and having worked closely with both of you. And just before I do that, Dr. Padova, is there a link that you can share with us for the donations for the simulation center? That would be helpful.
I think they send it. I think it's shared, right? Because I saw so much. Yeah, it's shared in the chat.
In the chat? Okay, so let me find it and
try to share it in the chat. And again, anything that we're now, one thing that we sort of didn't state, and I do want to make sort of pay attention to, is that the simulation center generally runs with contracts where we have outside or in-house departments that pay us to do simulation. When the war broke out, we felt an urge to help, and we decided that we would open our doors to the military, regardless of I mean, without charging, obviously, because we're in a situation of life and death. And we felt that if we could help save one soldier, for us, that would be enough. Since then, we've been fortunate enough to receive stories, telling us how the training really made an improvement and they felt differently. And we have a few like really eye accounts of how that helped. But all of the training that we've done for the military is completely at no cost to them. And so when the donations that we are accepting is literally like a lifeline so that we can continue to train. It's really, really important. And anything, if this group of amazing women can help get the word out, it will mean training and saving lives on so many, like in so many levels.
Thank you. Yeah. Thankfully, I have to say all of us here, I think, are working towards the same goals. So whatever we can do to help. I wanted to open the floor to Dr. Kasai to share a little bit about her experience, and from the volunteer perspective, and what it was like, and her perspective. Chevy?
Yeah. Hi, guys. So I'm Chevy Kasai. I'm a trauma surgeon in Denver. I know probably some of you who are on the Zoom. So like Mira said, and like I just said, I'm a trauma surgeon. And so a lot of the things that I see on a daily basis are pretty morbid. And I'm used to that. I'm used to lots of blood loss. I'm used to stopping bleeding pretty fast and having to make really fast-paced decisions. That's what I do for a living. But being in Israel was probably one of the most intense intellectually and physically, this trip to Israel, experiences that I had spent in a hospital in my entire career. The volume of patients that they were seeing at Ichilov and the volume of physicians who are not surgeons that they were training to be able to perform, complex procedures on the battlefield was just staggering to me. I'm honored I was able to take, just a small part in helping with all of that. But I think, even more importantly, because I'm just one doctor, I think it was amazing for me to be able to come back to the US and, attest to the fact that this is really what's going on. This is the help that's needed. This is what we can do from the States, and just to understand that. So, I'm heading back to Israel in a few weeks to go help up north. And in a weird way, I'm looking forward to doing that because I'm looking forward to be able to provide something unique in terms of my skill set. But I'm so proud of our colleagues in Israel and all that they're doing on a hourly basis to save lives. So including Talia, but everyone else there too, all the ER doctors, because there were tons that I met and got to interact with, and all the surgeons there too.
So just to elaborate on what you were saying, and of course, Dr. Kapoor, if you can pitch in with this, the demographics of the people that you're training in these simulation centers obviously was very varied. Even the one group that I saw when I was there had a whole range of different participants. So I don't know if you have maybe a rough breakdown just to give us an idea of so many different levels of people that need to be trained, not medical, non-medical, and even within the medical world. Obviously, we know an ER doctor being trained to intubate is not the same thing as a pathologist being trained to intubate. I mean, it is what it is. So
I'll say that we started. Sure. We started when we started training, we started literally, again, going back to sort of Israeli agility. We took a bunch of models, we put them in the back of my car. I had two amazing healthcare workers that work with me, and we just went. We got the okay from the Army to go to the Army base, and we went to an Army base. And when we got to the Army base, we were extremely surprised because we first started training like anesthesiologists and intensivists who were coming to sort of just recheck their skills. And then I saw somebody who looked very familiar, and I said, "Wow, I know you from somewhere." He's also American. We started speaking, and then I said to him, "Oh my gosh, you are my husband's dermatologist." And he said, "Yeah, now teach me how to intubate, please, because I'm going to the front in 6 hours." And that to me is the story. I mean, and he's been there since then. I mean, we check up on him every once in a while. He's one of the people that Dr. Padova spoke about, one of the 15%. And they're, doing incredibly important work that's incredibly different from the dermatology work that he does on a regular basis. So that's one case. So we really, really have a wide range, and depending on the day, um, um, we'll get different types of teams. We try as best as possible to cater to the teams. The day that you and Dr. Kasai were there was a day where we had either retired or almost retired family doctors who felt that they need to know how to intubate because everybody is on the front, and whoever was left is really us. Us female, like there was a lot of, if you notice, like female pediatricians or pathologists or geneticists, and they said, our community is relying on us. Our neighborhood is looking to us. So we need to know what we're doing. And it's a little bit more intimidating, but I think, we were able to teach, keeping things simple and going back to basics and the stuff that we know how to teach, and we've been doing for a while. We have an
If I can
amazing partner. Go ahead.
Now, I wanted to add to what you say that
Sure.
maybe people don't understand that what happened on October 7th, people realized that being at home is not safe. And that sometimes when such a mass casualty event happens, every healthcare worker is needed to take care of injured people. So many of the physicians and medics that are not experienced with trauma treatment had the feeling they have to be trained in case that happens again. So all those, we have neighborhood watches popping up in every neighborhood, of course, in faraway settlements, where they get together all the healthcare workers that live there and train them. And it's not only themselves knowing how to do a chest tube or an intubation, but how to work as a team. I mean, if something happens and they have to get together as a team and give medical treatment to trauma patients, they have to know how to work together. And that's what people say when they come out of the simulation center. We feel better now that we go as a unit, of course, a military unit, going together to the front lines, to Gaza. We know how to treat people, and we speak the same language. We do the same things the same way. And it doesn't matter if you're a gynecologist or a dermatologist or anesthesiologist, you know how to work together and do the basic trauma life-saving events. And I want to say something else that is very, we don't see mortality in the people that get to the hospital. I mean, soldiers that get injured in Gaza, they will get to Ichilov, which is, 40 minutes from Gaza by a helicopter. They get to Ichilov 45 minutes after being injured. They're already in the trauma room. Okay, 1 hour later, they're after CAT scan and in the operation room. That's amazing. And we know we had, like I said, we have more than 500 injured. We have only 2 mortalities in the people that came in the soldiers. They had injured, and didn't have a chance. And this is good. This is good work doing in the on the ground in Gaza with the trauma teams there, and it's good works in the hospital.
That's incredible. And honestly, a true attestation to the incredible work that's being done. I wanted to ask one more question, and I wanted to give Dr. Kasai, if she has any more questions from her perspective to add. Given that it sounds like there's simulations going on in the hospital and trainings, but also there's simulations happening either on the bases or out in the communities for the Kitot Konanut or whatever emergency response teams are out there. I mean, that requires manpower and staff. And as it is, some of the staff is down because people are called up. How are you coping with the manpower demands? Are you partnering with any other organizations that are accustomed to emergency response, like Magen David Adom or Ichilov or any of those? Is it all internal within the hospital? And where are you getting this manpower from?
In the hospital, you mean? How do we
Both in
cope
the
with it?
hospital, both in the hospital and with it on the when you're going out to do the simulations and the trainings. I mean, it requires people.
Yes, we have actually in the simulation center we have a lot of volunteers, and a lot of workers go double shifts now that in order to cover for the physicians that are not here. I mean, in the neurosurgery department we have 9 doctors that are recruited. In the anesthesiology department we have 15 doctors that are recruited now, but all the others that are here do double shifts. And it's not easy because today that I think more than 50% of the physicians are women, and first first of all, some of them are also recruited, but some of them are married to physicians that are recruited, so they have to do shifts and they have to be home with the kids. Where the father is recruited since October 7th, and it's a great challenge. But we're all here to do our job, and I think that I heard Dr. Kasai talking about how she felt, and also Tali said that she felt good. Being meaningful these days is the best treatment. For our sorrow and grief. Um, it's really the best option. Doing something that you feel is meaningful and being part of this. Uh, Big crisis and great challenge that we have these days, which I'm sure will come out from better, but we're still in the midst of it.
I mean, I think
100%.
that that's sort of what we do as moms and doctors and part women in the community. Dr. Padova was for 2 weeks in the army during the days and running the hospital in the nights. I was doing double shifts for colleagues and doing courses. We rely a lot on each other. My kids have had significantly less schnitzel in the last few months, but they're fine. And Dr. Kasai worked like triple shifts, got on a plane, was in Israel for 3 days, left again. And again, none of this could have, like, it all had to be done with all of the help from organizations like yours. Giving, if we didn't have the ability to fund the project, we couldn't move forward. I think the push was really like, we really, really need this as a group. And so everybody's been working really, really intensively. I guess I have a
That's
question for
amazing.
the group. I was going to ask you because we are very I guess we see the Hasbara as like in terms of what is being shown to the outside world from one, like very much from our perspective. What can we do to sort of get the message to the rest of the world? What kinds of videos? I mean, we showed you a video that we put together. How can we get the message out of the help that we need?
I think that's a great question. I think there are a lot of outlets that have been used. I am by no means an expert on communication or skills to get that, to get things out there. But, Ichilov Medical Center do they have like a campaign, like a PR team, outreach team? Those videos that you showed us and the testimonials, I mean, they should all be out there, social media, in direct contact with networks. There's a tremendous amount of activity that happens in social media. So I haven't checked this, so I don't know what Ichilov Medical Center has been doing in terms of their outreach in social media and through, various newspaper communications. But just as a layperson looking at the media, that I would say that that's probably one of the best ways to communicate with the world at the present time. Dr. Kasai, I wanted to ask you if you had any questions or anything else that you wanted to add here.
I mean, just
before we open up to the group. Yeah.
to answer Tali's question in probably a more pessimistic way than you did. Sorry. I think you guys do a great job in terms of Hasbara, and I see your social media activism, and I see the videos that get posted on different physician groups and stuff. But I mean, it was a poll that I saw. It was on one of my Israeli WhatsApp groups this morning, and it came out of somewhere in the U.S. It said it was from Harvard, which we know Harvard's not pro-Israel anyway, but the poll said that 84% of over 2,000 people that were polled agreed with the Hamas invasion on October 7th and, think that Israel should not necessarily exist. And this was a group of 18 to 24 Americans. So my point is that, this is a losing battle in terms of social media and diaspora in the U.S. And really just like, it's always been for thousands of years, we can't really depend on anyone else besides ourselves. We can't depend on humanitarian aid from Doctors Without Borders or the Red Cross or any of these other groups because they really don't care and probably are praying for our destruction. So we have each other to rely on, and just know that you have the entire, U.S. Jewish community and medical community in the U.S. Of Jews, you and other countries too. But yeah, so I don't think there's a good answer to that question, I guess. But I mean, I don't have any specific questions for either of you guys. I'm honored to have had a little bit of an opportunity to work with you, and just putting it out for anyone else in the chat. If there are any ways that you see, just from the four of us kind of talking over the last 45 minutes or so, that you can help, even if it's just kind of getting the message out. And hey, I think that I know someone who runs a simulation center at my medical school or wherever. Is there any way that I could help? Definitely be in touch because we could use all the help we can get, and we'll hook you up with the right people.
Thank you.
Thank you, Dr. Kasai. I wanted to open the floor up to our participants and attendees. Anybody else have any questions? Please post in the chat. Yeah, the chat is open for everybody to post, correct?
I'm trying to check on that too. I'm not sure. I'm not an expert at this like Yael. So.
Yeah, same here. One thing, though, I did want to add to what you're saying, Shiv, which is 100% true. I think, though, outreach to Jews around the world, like you just said, is extremely important. And you're right, we have just us to rely on. And I think that's where the focus needs to be emphasized and the energy needs to be spent. Because very simply, it's us for ourselves. So I do agree with that. Okay, so yes, people can post from the chat. Anybody with any direct questions? I know there was a lot that was said here, so it's hard to imagine. It's hard to imagine what these amazing people have been going through and the amount of time and energy that they've been dedicating to this. But if there's anything else that anybody wants to ask, please feel free. Otherwise, I'm going to wrap it up here and say thank you so much, Dr. Padova.
So someone just put a question, Mira. They said, how are you supporting psychologically the healthcare workers seeing more loss of healthy youth than many of us see in our whole careers? So Dr. Padova, I think you earlier.
Well, it's a good question. I mean, we do try to take care of ourselves because we are all exposed to a lot of sorrow and grief, and as I said, this terrible experience of October 17th and the loss of our young soldiers. And we do make, groups of treatment for healthcare workers. We have them, to a free and open door to our hospital psychologists, and they all know how to get there. And we also do reaching out to them. Um, we do the best we can, but the feeling is that it's not enough, and we need to do more. And as I said before, we're trying to get training of people that are not mental caregivers, to have them be the first survey of the treatment before the mental the professional mental clinics. And we'll do those trainings in the simulation center also.
Yeah, so we have, I'll add a little bit to that. We have a resilience team within the hospital. It's actually very new for Israel. I know in America and Canada, they have things like this. And as soon as within the first week already, there were constant emails. We have a kind of like a management mail email that's either daily or weekly. So they would post specific sessions. So they gave all the healthcare workers a number of free sessions with psychologists. That was one option. They did mindfulness. Um, Actually web mindfulness. They provided childcare and dog walking for some of the physicians at the beginning, when really we needed all the help we could get just to arrive to the hospital. I mean, I'll remind you that we did our children were not in school for almost a month. And so the hospital provided school, like a daycare system for our children, which is, to me, I always feel extremely fortunate to work in a place like this, especially, coming from the States. And it's very much, there's a huge influence, a huge emphasis on becoming better. One of the projects that we try and do is drama therapy, which we have a course in our medical center, in our simulation center, but it's very costly. And so the average department doesn't have money to invest in such drama therapy and things like that. So it's going to be a problem. Maybe that's something that if people are interested in, they can help us, have sort of a campaign for, because we're really helping the healthcare workers is going to be our next huge project.
That's amazing. And I do think maybe we can continue to discuss perhaps facilitating telehealth for these purposes as well, to help both patients as well as the healthcare workers for everything that they're seeing and everything that they're going through. So that's thank you for that. That's amazing. Any other questions from the attendees? Okay. Again, I wanted to say thank you to everybody. Thank you for your amazing services. If you need a GYN oncologist, I'm here and happy to come and help at any time. Always looking for a good reason to go to Israel. And for this, that would be amazing. And we'll be in touch. We're here to help any way that we can. Continue to help with the simulation center. And if you are aware within the hospital of specific deficits of doctors that we can bring in to help in specific areas, we do have doctors who are ready to come and happy to come. So just let us know and we'll be happy to supply it.
Thank you very much. Thank you.
Thank you.
Thank you, everybody. Okay, have a great day.
Bye-bye, Shavua Tov.
Shavua Tov. Bye-bye.